Good afternoon, and thank you for attending the final OTI session. What is EDI and how can we weave EDI principles into our practice, which is learning and teaching? I am Everett Igobwa, lead educational developer, critical pedagogies and equity, diversity, and inclusivity. The University of Alberta respectfully acknowledges that we are located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Anishinaabe, Inuit, and many others, whose histories, languages, and cultures continue to influence our vibrant community. I will read out the access check adapted from the University of Toronto and borrowed from my colleague, Mandy. For transparency, we understand access to be a shared responsibility between everyone in this space. Our goal is to strive for an inclusive and accessible space that reduces the need for anyone to unwillingly disclose a disability or impairment for the purposes of gaining an accommodation. We want to be mindful about distinguishing between formal accommodations, itself sometimes a difficult process to navigate, and access needs, which we all bring to our spaces from a variety of social locations. In doing this work together, we strive to welcome disability and the changes it brings into our space. If you have an access need that we have not addressed, or you notice a barrier that doesn't directly impact your engagement, but may impact that of others, please feel free to bring it to our attention via whatever channel you prefer. During this session, we will define and examine EDI. We will then discuss our 8 EDI principles at the University of Alberta as they relate to learning and teaching. This will include framing them in theory using critical pedagogy. We will also offer practical examples by illustrating EDI principles in our teaching practice using 2 examples by 2 of our professors and 2 undergraduate students. And lastly, we will connect the EDI principles across disciplines. I will collaborate with 4 co-facilitators during this session: Assistant Professor Lisa Willis, Associate Professor Jaime Yu, undergraduate MD students Kuda Hove and Tom Sorosky. To answer the question, who am I? I was born in Kenya in East Africa, and I relocated to Canada 20 years ago as a trained K-12 teacher. Colonialism had a part to play in my schooling as I attended the Prince of Wales School in Nairobi, renamed Nairobi School, when Kenya gained independence. In Kenya, we followed the curriculum of the empire, and I recall in grade 9 studying the history and geography of Canada and Australia, dominions of the British Empire. I am an educator, musicologist, ethnomusicologist, African studies scholar, and post-colonial theorist. To this end, I find that my post-secondary teaching and educational development journey have been influenced by post-colonial scholars to include Edward Said, Gayatri Spivak, Homi Bhabha, and others. Colonialism is a backdrop that has impacted what we do in post-secondary education. To this end, we find the realities of the empire as we strive to decolonize and indigenize curricula. Also, there are neocolonial nuances in post-secondary education that continue to impact EDI, and we encounter them in a good way. My portfolio as a lead educational developer, critical pedagogies and equity, diversity, and inclusive includes, among others, 1, anti-racist and anti-oppressive teaching, 2, disrupting approaches to power, 3, privilege in teaching, 4, decolonization, indigenization, and EDI, 5, critical race theory, and 6, critical pedagogy. As a post-colonial theorist, a framework that comes to mind as a result of anti-racism, decolonization, and neocolonial sensibilities in higher education is the lens of othering. This is a binary opposite deconstructed as conscious or unconscious bias and proposed by Edward Said in his monumental monograph, Orientalism, in 1978. And I quote, "The development and maintenance of every culture requires the existence of another different and competing alter ego. The construction of identity, whether Orient or Occident, involves establishing opposites and otherness whose actuality is always subject to continuous interpretation of their differences from us, end quote. Said sets up his narrative with the Occident, the colonizer, and Orient, the colonized, with othering as a terminology of difference. And this may offer some insights as we navigate diversity, inclusivity, and equity via multiple identities of students in our teaching spaces. Building on the theory of othering, Mary Canals, a nursing professor at the University of Wisconsin in 2000, proposes inclusionary othering, and I quote, usually seen as the opposite of exclusionary othering, which uses power in relationships for domination and subordination. Inclusionary othering is a constructive, positive process to connect with people through their differences and uses power in relationships for transformation and coalition building, end quote. Critical pedagogy informs my EDI work, and someone who comes to mind is none other than the iconic Brazilian educator, Paulo Freire, with his foundational monograph, Pedagogy of the Oppressed, referenced on Tuesday by my colleague, Brad, during his presentation. Pedagogy of the Oppressed was written in 1969 in Portuguese and translated into English in 1970. I will refer to a quote in chapter 2 on page 72. And here's a quote. Education must begin with the solution of the teacher-student contradiction by reconciling the poles of the contradiction so that both are simultaneously teachers and students, end quote. In chapter 2, Freire introduces the banking concept, a metaphor for autocratic teaching where students are perceived as empty vessels, tabula rasa, and the instructor positions themselves as sage on the stage. Democratizing pedagogy using collaborative and student-centered active learning in the classroom is a paradigm shift that we ought to embrace as guides on the sides or facilitators. My colleague Chris explored the notion of sage on the stage yesterday during his presentation. Whole person and social location. We are whole people, and this holistic perspective centers on the mind, heart, and ego by nurturing pedagogies of care, compassion, empathy, social, emotional, economic, and environmental conditions. Further deconstruction of who we are personally, socially, and professionally underscores social location, which includes community affiliations such as social class, sexual orientation, gender, age, race, religion, belief system, disability, and geographic location. To this end, social location ought to be considered alongside the individual uniqueness of learners and instructors alike, which aligns with our ultimate collective objective undertaking to collaborate in nurturing inclusive, just, and student-centered learning spaces. My colleagues Mandy and Andrea referenced social location in their presentations and additionally pointed us to the social will developed by the University of Michigan. This is an amazing tool that we can use as educators in the classroom in an effort to appreciate intersectionality to inform our identity as whole people. To this end, critical pedagogy, post-colonial theory, and the reality of social locations are a few lenses that I use to interrogate EDI. Now we are going to watch a video, the difference between equity, inclusion, and diversity by Ritu Basin, who is a DEI expert. Graham, please put the link in the Jamboard, the link for the Jamboard in the discussion, and use that link to highlight important takeaways. I will play the video.
Given all that we are seeing happen in the world right now, we're hearing a lot about the concepts of equity, inclusion, and diversity, including me receiving a lot of questions about what are the differences between these three concepts. So today, that's exactly what I'm going to talk about in this video. Let's start, first of all, by talking about the concept of diversity, since I would say it's language that we most often hear used when we're talking about bringing people together across cultural communities. So diversity is essentially about the quantitative representation of differences. It's about measuring how many women do we have within the workplace? How many people of color do we have on this board? How many people from the LGBTQ communities make up part of this society, and so much more. Essentially, what we're doing when we're taking a look at diversity is measuring the representation of cultural communities in our society, in our organization, in our mix. Inclusion is about not only the quantitative representation of difference, but more importantly, it's about the qualitative experience around differences. That is to say, when we're talking about inclusion, what we're really focusing on is the extent to which people can bring their whole, true, authentic cultural selves into their interactions, whether that be at school, at work, in their personal interactions and relationships, and more. Inclusion is extremely important because when we're focusing on the qualitative experience of differences, what we're really trying to push is both authenticity, you're able to be who you are at your core, and still attract, opportunities, which means that you can be flourishing, thriving, having opportunities and more come your way on the basis of your differences. So that's diversity and that's inclusion. But the final concept, equity, is the one that is the most important of the three. Equity is defined essentially as our process of recognizing the historical legacies and the current realities of discrimination and prejudice that people from marginalized communities experience. It's essentially recognizing that not everyone starts from the same place, given the historical legacies of discrimination, which then also impact their current realities. When we dig deep into equity, what we also come to see and learn about are systems of supremacy, power, and privilege. So when I'm asked by people, which of these three concepts are the most important, or which should I focus on the most, I always say diversity and inclusion are extremely important, but really where you need to focus on the most is the concept of equity, because without equity, diversity and inclusion are not possible.
The University of Alberta's EDI strategic plan is guided by 8 principles: diversity, equity, inclusion, human rights, reconciliation with Indigenous peoples, accessibility, intersectionality, and equality substantive. At the Center for Teaching and Learning, we have developed teaching and learning attributes for the 8 principles as follows. Equity refers to fair and just conditions in teaching and learning to allow students to realize their full potential. Diversity is multiple identities of students in our classrooms. Inclusion is valuing and nurturing the ideas, thoughts, perspectives, backgrounds, and identities of the students. Human rights are fundamental rights in the classroom to be and belong as who we each are as whole people. Equality substantive is consciously addressing the range of conditions that deny equity to individual students and student demographics in the classroom, conditions that create opportunities for identified disadvantaged students in the classroom. Intersectionality is the way that individual axes of oppression compound and interweave in who each person is in the classroom, and how these axes never exist separate from each other, but always interlocked. Accessibility is physical, pedagogical, and administrative structures designed and redesigned to foster, facilitate, and empower students' success. Reconciliation with Indigenous peoples means beginning in truth and moving toward the building and sustaining of respectful, responsible, and ethical relationships with Indigenous peoples and all those living across the nation we now call Canada. Equality assumptions. I facilitated an EDI workshop, and these are some of the equality assumptions that the participants generated. 1, students have the same opportunities. 2, students have equal opportunities. 3, students have the same potential for success. 4, I treat all my students the same. 5, there is inequality in society. And 6, we can measure equality in the classroom. Nurturing equity in the classroom. One, identifying barriers that exist and removing them, and this is through your teaching philosophy. While teaching an undergraduate upper level course, I would ask each student 3 questions. 1, why are you taking this course? 2, how will you contribute to this course? And 3, what may stop you from being successful in this course? 2, fairness in terms of outcomes or competencies. Given diversity of students in the classroom, using differentiated learning may assist to nurture student success. 3, accommodation policies. Accommodation policies may be tailored to support student success in meaningful ways. Number 4, how do we value differences between students? And this you might infer because students don't have the same opportunities. By conducting a needs assessment, may be an avenue to explore in order to support the needs of the diverse students in your classroom. 5, course design and redesign, leveling the playing field. You could, by conducting, using outcomes, incorporating them into EDI, assessments that are authentic, UDL and pedagogical concepts successful in nurturing EDI. Some other strategies as well are peer mentoring, group work, team-based learning, TBL, flipping the classroom, open education resources, and critical pedagogy as I discussed earlier. Diversity training. As educators in the classroom with diverse students, engaging in professional development to address cross-cultural training, intercultural teaching competencies, anti-racism training, as well as power relationships in the classroom may be useful. Nurturing inclusivity in our teaching practice helps to address the student diversity that exists in our classrooms. It is important for us as educators to intentionally create safe learning spaces for students. To this end, the ideal classroom is a space that offers physical, pedagogical, and emotional safety. My colleague Anita has a website on the CTL YouTube site that addresses teaching with compassion. Please review it. We need to endeavor to make our students feel welcomed in the classroom, especially with some transitioning from high school or others returning back to school. An inclusive classroom will better assist our students in settling down as they adjust to post-secondary learning. And these adjustments are also further determined by the reality of social location. Inclusive course design. So inclusive course design is a strategy that may assist in navigating EDI issues in the classroom. Additionally, decolonizing the course content enables us to weave diverse perspectives in our courses. An example that comes to mind was shared by a professor in the Faculty of Medicine in their dermatology course, where the textbook does not represent all skin types. That said, the professor found an open education resource online that solved the predicament. We can endeavor to collaborate with the students in order to identify barriers in the course, be they equity, diversity, or inclusivity, and strategies together on ways to mitigate this. Using OERs, peer-reviewed journal articles, contemporary case studies, videos, and inviting guest lecturers may assist in nurturing inclusive content in the course. Nurturing inclusive classroom practice may include promoting the use of inclusive language in the classroom. This is a learning curve for all where learning and relearning will take place in an effort to achieve this goal. Championing EDI literacy in your classroom may result in a collaborative project with your students to include an equity, diversity, and inclusivity statement in the course syllabus. And the EDI statements may be revised annually by the instructor and students. It is important for all in the classroom to be addressed with the pronouns they identify with. Also learning their names and learning to pronounce them properly. Additionally, it is helpful to use gender-neutral words and terminology in the classroom as we champion gender diversity. Tommy Mayberry, Executive Director, CTL, has developed and facilitated a webinar on gender pronouns that you can access via the CTL YouTube channel. Here are some inclusive pronouns from the University of New York website. So now we come to community agreements. EDI principles may be considered when we engage in collaborative tasks in the classroom, such as organically creating community agreements for classroom discussions. And here is an example whereby everyone's opinion is important, listening attentively to others, and I may add with an intention to understand, seek clarification, empirical evidence for opinions, only relevant issues, agree to disagree respectfully, and learn how to refer to peers respectfully with the preferred pronouns. We are now going to have a group activity for 12 minutes. This will be an EDI paragraph mini statement for course syllabus. So we have just explored the 8 EDI principles. Each group is going to have 4 members, and each group member is responsible for 2 EDI principles and communicating the concepts to the group. So please collaborate in crafting an EDI paragraph or a mini statement for a course syllabus. There is a Google Doc which Graham will throw in the chat as Graham divides us into groups. Thanks so much, Graham. So see you after 12 minutes and have fun writing your EDI paragraph mini statement for course syllabus. Yeah, so thank you all for that activity. I will suggest that we will come back to that. So the next part of this session, we're going to have 2 presentations. The first one by Assistant Professor Lisa Willis, and then by Associate Professor Jaime Yu. So Lisa, over to you.
So I'm a professor in biological sciences, assistant professor. I've been here for just over 3 years. I am a biochemist, and I teach, oh, perfect, thank you. I teach a couple of large courses. I am also the founder of Inclusive STEM. Yeah, there's my teaching background. So I teach Micro 265, which is introductory microbiology. That's 360 students. Can you go? Yep, thank you. I teach or taught zoology 352, which is 93 students. And I know it says principles of parasitology, but I know nothing about parasites, even having taught that course several times. And then I also teach a small graduate course. So that's where I'm coming from with regards to teaching. But like I said, I founded Inclusive STEM, which was based on this idea that scientists in particular need information about EDI from very much a data-driven literature. This is how they're comfortable working with information from that perspective. And so that's my understanding of EDI comes from that. So you can go on to the next slide. So people from marginalized communities are thinking about the classroom, they're more likely to have to work to support themselves and sometimes their families as well. They're more likely to be caring for relatives that could be children, but also parents, grandparents, etc. They're more likely to come from lower income backgrounds. So if we think about, before I move on, actually, if we think about what this means, so if they're more likely to have to work to support themselves, that means they have less time to do homework, to work on activities, that kind of thing. If they're more likely to be caring for relatives, also, they might have less time. They might also have considerations regarding health. We saw this especially with COVID. There are people with elderly grandparents or immunocompromised family members that made it difficult for people to safely attend university in person. They're more likely to come from lower income backgrounds. So again, they're more likely to have to work to support themselves, less likely to have high-speed internet, be able to afford textbooks. So they may have to go to the library and try to borrow textbooks from other people. They're more likely to be a first-generation student, which means that they don't necessarily know how to navigate the system. They don't know about accessibility services. They don't know how to reach out to student advising. They don't know about project courses. I had a really nice discussion with my second year micro class about working in labs. And it was really interesting to hear from them. Some were like, but we have no experience. How on earth can we ask a professor to work in their lab as part of our undergrad? And I had to explain to them that we actually expect them to not have any experience. It's quite okay. And how are they to get any experience if they don't reach out? So that was a really interesting discussion. I'm a first generation student, so I struggled with a lot of these things when I was an undergraduate as well. Next slide. So they're more likely to feel like they don't belong / aren't smart enough to be here. This is imposter syndrome. I think the vast majority of people experience imposter syndrome at some point, frequent careers. But for people from marginalized communities, that feeling of inadequacy is frequently reinforced by external forces, by not seeing role models who look like them, by not having family members who have gone, that same direction, and by having colleagues or instructors tell them that they don't belong here. We know that still actively happens at universities and in high school. They're more likely to experience harassment by their classmates and their instructors. They're more likely to struggle with traditional teaching methods. So people who have learning disabilities, for example. I, just as an example, cannot hear things and follow auditory instructions. So listening to a lecture is really challenging for me when it comes to my learning, because that's not how I process information. It takes me a really long time to think about that information before I really internalize it. And so sitting in a 50-minute lecture, I couldn't even, there's no way I could ask a question because I've not even processed the information yet. So things like active learning really help me with that kind of thing. Next slide. So there are sort of 3 areas that I think we can apply EDI in teaching. And these are just 3 off the top of my head. One is in course structure, and this applies to anything we're teaching. And I think some of this has been talked about already in this wonderful symposium. So one of the things that I've done, and so Everett asked me to talk about my own personal experiences, so that's what I'm going to talk about. In teaching Micro 265, I have lectures, or the lecture portion of the course, instead of having 1 midterm and 1 final, which is pretty traditional in the science courses, I had 3 smaller midterms and a final exam. The lowest midterm mark was automatically dropped, and the final was only worth 30%. So the EDI considerations here are that there are students who, for whatever reason, maybe they have to work extra hours, maybe one of the family members that they're caring for is sick, maybe they have a disability and they have some extra doctor's visits or hospital visits that they need to make. For whatever reason, nobody can be on top of their game, for 100% of the semester when you have all of these other barriers that you encounter. And so by offering this inherent flexibility in the course structure, I've made that a little bit easier. And by having the final worth only 30%, it's lower stakes and it's less stressful for the students. The textbook was optional and there was an online version available. We've talked about that already. My online videos were subtitled, and this was actually really interesting. I got so much feedback about how valuable it was to have videos subtitled because students were able to follow what I was saying better. And probably these are students like me who have a hard time processing information that comes to them verbally. And so I got lots of comments. They found that really useful. And then I provided interactive vocab quizzes. I just provided a lot of supplemental material, vocab quizzes. I think on the next slide, I mention also practice questions. Can you go to the next slide for me, please? Yeah, study questions, that kind of thing. One of the things that we know about student learning is that they learn better when they are working together with other people. And so I in the forum for students to form study groups. And during the first, I actually talked about how the data that shows that students learn better, that everybody learns better when there are interpersonal interactions that happen when you form groups. And so I explained to them why this can be really beneficial so that they all had access to that information. And then I created a space so that they could actually meet one another. This was really good for first generation students, for students who didn't necessarily know how to navigate the university system, and for students who didn't have friend groups. So again, when you're part of the dominant demographic, it's really easy to form these social communities that can assist with learning. And when you're not part of that dominant demographic, it can be really hard. So enabling students who didn't necessarily know one another to reach out and say, hey, I'm interested in studying, that was really useful. One of the things we also did was to practice answering short answer questions in class as an active learning session. So I put up a question, a short answer question that would have been on the final exam. And we were online at the time, so I put them into breakout rooms and I got each of them to answer it in a Google Doc. And then with them, I went through and I graded them and I explained why this one would have received, 0 out of 4 and why this one would have received 4 out of 4. So they actually understand what it means to answer a question. And then we also used breaks during class to talk about resources, whether those are mental health resources, whether they need to reach out to student advisors, about the project courses, I mentioned that. So actually working in a lab, how do you approach a professor? How do you start that email? Is it okay to cold email a professor you've never talked to before? How do you study? What are studying tips and tricks? That kind of thing. We had conversations about things that were not directly related to the course content, and they found that really helpful. Next slide, please. So then so that's sort of the structure of the course. And then thinking about how you actually manage your class and the interpersonal interactions. One of the things that I do right at the beginning of the class on the first day is talking about cultural hierarchies. And this is partly because it's a really useful thing to talk about, but also partly to get people thinking about diversity and people who are different and how they might have different approaches. So there are certain cultures that are really hierarchical. You would never call somebody with more power than you are by their first name, for example. You would always call your friend's parent Mr. or Mrs. or whatever, so-and-so, right? And there are cultures who are very much not like that. So for cultures that are really hierarchical, the idea of a student calling out a question, yelling at a professor in a classroom is just, that's not appropriate. And they would be very uncomfortable with that. And there are other students for whom that's perfectly fine. And there are professors who feel that one is rude and the other's not, or vice versa. And so actually talking about, okay, so you can absolutely call out a question to me, or you can raise your hand and I will do my best to get to you. And the reason that I do this is because of these cultural competencies. So I actually explain to them that people have different ways of communicating, different ways of learning. And it gets the students thinking about these kinds of things. Growth mindset. So people from marginalized communities have this real, I don't want to call it an inferiority complex. I've just totally blanked on the word that I used like 3 minutes ago. But this idea that they don't belong, right? That they're not smart enough to be there. And so we know that particularly for women and some racialized communities, this idea that in higher education, it's not about facts, it's not about an inherent ability to do it. it's a skill. Even science is a skill. And with every skill, you can be bad at it at the beginning, and the more you practice, the better you get. So you can actually grow and get better at doing things. And that eliminates this idea of, well, there are a couple of geniuses in the classroom, and you know, they're so much smarter than I am, and I'm really dumb. You're not dumb, and you can absolutely get better. You just need to work hard, and let's talk about strategies for working hard. There's some really cool research that shows that small groups work better when there is when everyone's opinion is heard, when everyone has the ability to share what they think. It's a higher proportion of females in the group to about parity, and that's partly because women in North America are socialized to make sure that everyone in the group is having an opportunity to offer their opinion. When social perceptiveness is something that the group pays attention to. So how is everyone feeling with regards to what's just been said? Those are the groups that work together the best, that actually complete the task the fastest. Those groups that take social perceptiveness and parity and conversational turn taking into account when they are working together are better at doing the task than the groups with the smartest member in it, or the group with the average highest intelligence. And I liken it to working, you know, in a sports team. The sports team that wins the championship is not the one that has the highest goal scorer in it. It's the team that works together the best. And that seems to resonate with students. It gets them thinking about outside of themselves and what they need, and thinking more in a collective way. And then we talked about pronouns, so maybe I'll just talk about neurodiversity. So I actually had a student in my class who came up to me and told me that they were autistic. And from my understanding of people with autism, not because I have any education in it, but I know that sometimes people with autism have problems with eye contact. And so one of the things I said was, is there a way that I can make you more comfortable? I know that eye contact is a problem for some people. Would you prefer that I not look at you? Would you prefer that we stand side by side when we talk? Would that make you more comfortable? Is there any, you don't even need to know these kinds of things. All you need to say is there something that I could do that would make you more comfortable? And so that was just one example of what I tried to do to make people more comfortable. I really love this statement. This is not a statement that I came up with. It's something that somebody told me a couple of months ago. And it was the adage, treat others how you want to be treated. It's not about how I want to be treated. I have no need to avoid eye contact for me. But there are other people who do. And so it's really about decentering yourself. What can I do that would actually make somebody else feel more comfortable, my student feel more comfortable? Interpersonal communication within the classroom. And then obviously there's a place for EDI in course content. So one of the things, I do this in all of my courses, there is always an opportunity to bring up, in every course, I think, to bring up EDI considerations in the material itself. In parasitology, for example, the vast majority of parasite burden occurs in African, South Asian, and South American countries, and we're obviously not there. And so one of the things that I did was to have pre-recorded conversations with experts around the world about the research they were doing. And one in particular, I made sure that there was gender balance, and there was racial balance, and there was balance from geographical locations. And one of them in particular was a conversation about malaria and the parasite that causes it, Plasmodium. And the person that I interviewed was Dr. Imahali. She's a researcher from Kenya who grew up in Kenya. She went to the Netherlands to do her PhD, and then she came back to Kenya. And she's been studying ways to reduce malaria transmission. And it was really interesting because one of the things she talked about, so there's these nets, these bed nets that go over your bed that are impregnated with an anti-malarial, essentially. And so you have to put the net over top of your bed when you sleep in order to keep out the mosquitoes. But poverty is such an issue in these villages that instead of using these nets as bed nets to protect themselves from malaria, the people of these communities use them to fish. And so, you know, we here in North America can do anything that we, you know, want to come up with new treatments and things like that, but without actually understanding the cultural context of the people that we are trying to help, without having conversations with them, without including them in the research, how can we ever actually make any progress? We're wasting our time, essentially. So that was just one of the conversations that I had. We had lots of conversations about the history of science and how it's important to remember that science is very much political. Who gets to do science, what science gets funding, etc. Next slide. And the response to thank you was overwhelmingly positive from the students. So these are just comments that I got in my USRIs after the class was done. And their comments about appreciating the inclusivity in the class, representation of marginalized groups, racism and sexism that currently exists, all of these kinds of things, they really appreciated. Next slide. I don't know if you put I put a bunch of these in, but you've made the text bigger, which is probably awesome. So we probably don't need to go through all of them. Essentially, suffice it to say that there were a lot. I think I got one comment from a student who was angry that we talked about politics and science, because he said that politics had nothing to do with science, and obviously that student had a lot to learn. And I got dozens of students commenting on how they really, really valued that conversation, and they felt that it added to the class. So that is all that I wanted to talk about. Obviously, there are, you know, thousands of different things that can be done in a course to make it accessible. These are some of my experiences, and I'd be happy to answer questions or to chat more with anybody in the chat about things that they find interesting.
I'm just wondering, for Lisa, for accessibility, could you maybe just read them out, starting with the first one? If we maybe just
I can read them out. Yeah,
if you don't mind, yeah, thank you.
I appreciated the inclusivity in the class from the comments made about the misrepresentation of marginalized groups in videos, as well as bringing up the racism, sexism that is found in these fields of work / research and in society in general. I believe it is important to incorporate those topics into learning any subject class, and should honestly be taught more, in my opinion. So I appreciated that. Dr. Willis is awesome in that she really brought the social aspect of science. Through this course, I realized that research can contain outdated ideas, though it may be from credible sources. The professor taught students to be careful about misrepresenting marginalized groups in our research projects. I think this is important to keep science free of prejudice, and applaud her for doing this. This was actually really interesting, this comment, because what we talked about was homophobia. And so one of the first places that a particular parasite was found was in the gay men population. And so there were a bunch, this was in the 80s. And so there are a bunch of research articles about how this is a problem in gay men. And when the students did the literature review, these are the first things that they found. And so this is the information that they propagated. And so then we talked about how homophobia is what was a huge part of why that got published. And actually subsequent literature showed that it wasn't just a problem with the gay male population. And it's interesting because now we're seeing similar things coming out of monkeypox. So, you know, history repeats itself. I liked how you brought light to current issues as well, such as women in science. I also really appreciated how she addressed social and ethical issues in the field. I also appreciated her transparency and honesty when addressing injustices in science. I never took much time to think about it, but I'm glad she continuously brought it up since it does play such a major role in who gets studied and how it affects everyone else. Next slide. Is that the last one?
Yes, that is the last one. Yes.
Perfect. Okay. Yes. So that's the other thing that I just wanted to mention very briefly was this idea of transparency. I think it's really important. The status quo is perpetuated, or the ability of the status quo to be perpetuated is enhanced in part by a lack of transparency. And so I think that anything that we can do to explain why we're doing something, what we're doing and why we're doing it and why that's the best way to do it is really important from an EDI perspective. And that's it. I will stop talking.
Yeah, thank you. Thank you very much. Thank you very much. Lisa, please clap for her. Now I hand over the presentation to Associate Professor Jaime Yu and her undergraduate students, Kuda Hove and Tom Sorosky. Kindly excuse there's a typo on the on the slide. Welcome, Jaime.
Perfect. Thank you so much for the invitation, and we're very happy and excited to be here with everyone. So I'm Jaime Yu. I'm an associate professor in the Faculty of Medicine, and I'm actually the pre-clerkship director with our MD program, so that's our medical school. I'm a clinician as well. My work as a clinician, I'm a rehabilitation physician. So I work out of the Glenrose. We focus on stroke rehab and with individuals with chronic neurological impairments and disabilities. So all of this work very close to my heart in many domains. Thank you to Dr. Willis for sharing her personal experiences. Our talk here will hopefully showcase a little bit of work that we've chosen to embark on over the summer. I have Tom Sorosky and Kuda Hove are both first year or going into second year MD students in our program. And I think it's more taking a lot of the reflections from Dr. Willis and bringing it into light of how are these changes carried out on a actual more like systemic basis. So in the MD program, looking at our curriculum structure. Can I get our next slide? I thought it'd be worthwhile just to share with everybody the structure of our program, because it's a little bit different from, say, if you're running a single undergraduate course, and it just helps to frame a mind of the work that we're undertaking right now. So the MD degree program here at the U of A, it's a 4-year program, and the way it works is your first 2 years is based in the classroom, and our courses occur sequentially. So they do all of a single course, followed by the next one, followed by the next one, rather than say a traditional like a bachelor's degree where you're taking a course load of 3 or 5 courses over the term, right? So everything's kind of just done in a sequential fashion. And then you see there that based on the content, the duration of a course varies. So everybody starts first year in this massive course we call Foundations of Medicine, which is a lot of basic science, but also bringing in some early clinical thinking along with that. And we use a variety of instruction methods in all of the courses. So there is still a primary lecture-based component, which is probably at least 50% or more of the time. And then we use a variety of different types of small group settings. So some are case-based tutorials where they're working with clinicians in the specialty area and working through problem solving. What we're going to talk about in this session is our discovery learning. So if we can go to the next slide, please. So discovery learning, I know it's a pedagogy unto itself and its own type of theory, which we won't get to in too much detail. In the context of our MD program, that's kind of what we call our almost like problem-based learning sessions. These sessions occur in each of the systems courses. They're 3 times per week. The first 2 days, so day 1 is usually the Monday, day 2 is the Wednesday. It's about a 2-hour session where we have groups of 8 to 10 students paired with a faculty lead or faculty tutor. And these faculty, some of them are clinical physicians or other experts. Some of them are basic scientists and just other basic science faculty within our program. And so they don't have to be somebody working in the field. They don't have to be a physician for these. The cases are meant to be these real life simulated cases that walk the students through, a person comes into emergency department, or a person comes into clinic, and then they role play some of the interview, talk through what are the tests I want to do, or what was my thinking along differential diagnosis and management. And they work through these across all of the different courses. It's a key component of our curriculum. So I'll get the next slide. So what's the problem with these cases? It kind of speaks to a lot of the things that have already been highlighted, I think, in this workshop overall. You know, when these were introduced, a lot of this occurred in the mid-1990s when the program went through a big update to try and move towards active pedagogy or active learning environments and away from lecture. And then they created these cases. Sounds good. Problem is, there's been quite a variable degree of updates to those cases. And at that time, just like we've talked about historical, you know, scientific literature and other things, the conversation around things such as representation, as equity, as diversity was really not there. And so we're aware of that as we continue to use these cases in teaching. Increasingly, we also know that there is more awareness and focus on the social accountability role of our program, of our degree program, and as a medical school for our community. So that's where this project sort of took hold, is we wanted to look at two different aspects. One is to improve what we call the generalist focus of content. You know, we hear a lot about the need for family physicians and the need to approach things from a more general basis and not get too subspecialized, especially so early. And then the other piece is looking at where are we? We don't really have a great read on our current state in terms of equity, diversity, and inclusivity in our curricular materials. And so this was a little bit of an environmental scan, identifying where we are and hopefully setting a stage of where we need to go next. So I'd like to invite Kuda and Tom. They're the two students who've been working very hard at this project all summer, and they're going to share with you kind of what we actually did and what some of our preliminary and early results are. So Kuda, I'll turn it over to you.
Thank you so much, Dr. Yu. So if I could get the next slide, please. So the main purpose of the project that Tom and I worked on over the summer was to review all the discovery learning cases that we went through in first year. So that was starting off at the foundations right to the end in the Reno block. So to expand a little bit on the generalism side of it, looking at generalism, we're trying to take a holistic approach to understand all the individuals that we interact with in clinical settings and to try and understand them based on their own unique context. And part of this is accomplished by physicians taking a broad-based approach towards their patients and also working in collaboration with other healthcare workers within the system. And so what we're looking at is seeing if these cases highlighted some of the benefits of a generalist approach to the clinical problems. And this was typically displayed through the communication and just respect for generalist clinicians. And we looked at this based on some of the extensive work from the College of Family Physicians of Canada. Can I get the next slide, please? And then to talk a little bit more about the equity, diversity, and inclusion lens, what we're looking to see is if the cases explored the health disparities associated with race and ethnicity, and also the social structural determinants of health that have an interplay with marginalized individuals. And then we're trying to look and see if it was in alignment with the MD program strategic plan values. Sorry, if I could go back there for a second. Oh, there we go, thank you. Specifically looking at like cultural safety as well as diverse perspectives. I can get the next slide, please. Okay, so with regards to both the generalist and EDI lens, we used both of these tools. The first tool that we used was the TGAT, which came out of the University of Toronto, and that was what we used to assess the generalism lens. And then we also developed our own tool for the EDI side of things, and that was based on a guide from Krishnan, which is titled Race and Culture Guide for Editors of Teaching Cases. All of these cases were rated on a scale, a Likert scale from 1 to 5. 1 was when cases did not include the specific criteria that we're looking at. And then 5 is if they extensively discuss the criteria. And then 0 was if the specific criteria listed was not applicable to that specific case. Tom and I both review these cases independently. So I started off at the foundation and Tom started down at Reno, and we both got to go through each case. And so each case was looked at by 2 independent raters. And we focused on providing feedback that authors of these cases and the course coordinators of each block can use to make future updates and hope some improvements as well. So on the right here, we have a picture of all of the questions that we're looking at when rating for generalism. So as I mentioned earlier, the TGAT was actually developed out of the University of Toronto, and it is a validated tool. So some of the things that we're looking at to determine if a case met the requirements for generalism, we're looking to see if the importance of the doctor-patient relationship was highlighted, if a patient was presenting early, and this would give students an opportunity to kind of develop a differential diagnosis and try to get a better understanding of the body system. We look to see if there was any emphasis on the role of prevention and health promotion throughout cases. And then also just looking to see if there was that multidisciplinary team care that we mentioned as an important aspect of generalism. And lastly, also looking at advocacy. Can I get the next slide, please? And then with the EDI lens, so the tool that we used highlighted some of the key factors that you see here on the right. And that was something that Tom and I developed off the guide. And so it is actually not a validated tool that is available at the moment. But some of the things that we're looking to see is if cases highlighted the key causes of racial and ethnic health disparities and they interplay with social structural determinants of health. We wanted to see if these social structural determinants of health were actually also linked to a patient's health behavior, or if they incorporated any stereotypes instead of attributing a patient to a specific unique circumstances. And then we also wanted to see if like the treatment plans provided to patients or developed by students also identified and highlighted the social structural determinants of health. And lastly, we wanted to see if there were diverse range of identities included in the cases, and if implicit bias was discussed in any of the cases, specifically in relation to racial and cultural disparities. So once Tom and I had a chance to look at all of these cases individually, we got an opportunity to work together and go over the scores that we'd come up with. And we looked to see if there were any highly discrepant scores. So these were scores that had a difference of greater than 3. And then we discussed the rationale that we used to score each case. And for any case that we're able to come up to a conclusion, we're able to change the scores and discuss why we had found like the differences in our scores. So out of the 408 total scores, we changed about 24 of them, which makes about 6% of the total questions. Out of these 24 questions that were highly discrepant, we actually changed 19 of them. And the remaining questions that weren't changed were waiting for a review from the faculty who are working with us on this project. Can I get the next slide, please? Okay. So the majority of our edits were involved us changing the scores from maybe a 5 to 4, or changing it from a 1 to 3. And this was basically based on a discussion that we had to try and determine if a score actually reflected the quality of that case. And then the additional 5 out of 23 edits were made because we had differences in interpreting what the case, the information that the case provided. And then the remaining 2 out of 23 edits were mostly due to the reviewers failing to include a key part of information provided in the case. I will be passing it on to Tom now.
Thanks very much, Kuda. So I think this ties in nicely to what Dr. Willis was saying about how kind of scientists need data to have their EDI changes made. We wanted to compile the results that we had into a number of graphs and charts. So first of all, we scored a total of 24 cases. There was 12 generalism questions. By summing all of the scores out of 5, the average case got a score of 46 out of 60, so about 75%. On the chart on the right, I highlighted the highest and lowest average score, as well as which question that corresponds to. So the highest score was for question 1, which was, is this case relevant to the common problems seen in primary care? So in general, it seems like the cases are relevant to primary care. And this is kind of what we're looking for in terms of providing a generalist lens to the students. However, the lowest score was 3.3 out of 5. And this is for question just asking about advocacy. So that's a clear area that we could improve going forward. Next slide, please. Then we just broke up the generalism scores by block. So you can see the block that did the best was the pulmonary block, which scored about 50 out of 60 in generalism. And the lowest score was for the endocrine block, which was about 39 out of 60 points. Next slide, please. Next, we broke down the EDI questions. So you can see on the chart on the right, the highest and lowest performing questions. So on average, the total score was 12 out of 25. So this shows that the questions scored less than half of the total available points for EDI. So the average score was the highest, or 4.8 out of 5 on question 3. And this question is just asking if the patient history centers around unique circumstances and not racial or cultural stereotypes. So this suggests that the cases are doing a good job at describing each patient by their unique circumstances. However, the average score was the lowest, or 1.3 out of 5, for the 5th question, which asks, cases discuss implicit bias and critically reflect on racial or cultural disparities. And after some discussion between Kuda and myself, we really felt like the cases did not have any opportunity to discuss implicit bias, and that this sort of reflection was not found. This sort of reflection was rarely found among the cases. The last EDI question was just a yes/no question asking if a diverse range of identities was represented in the case. And unfortunately, only 8 out of the 24 cases were scored as yes for representing a diverse range of identities. Next slide, please. Then again, we broke down the cases by block. So Foundations block had the highest EDI score of 13 out of 25. And this isn't surprising, as Foundations tries to introduce a little bit of everything into medicine, including topics very relevant to EDI. But again, endocrine had the lowest average EDI score with 9.9 out of 25. Next slide, please. This graph is a little bit busy, but it's just showing each of the 24 cases along the x-axis and how they scored for generalism, or blue, and EDI in red. And what we're just trying to see is if there's any relationship between the generalism score and the EDI score. So as you can see, occasionally higher generalism scores correspond with higher EDI scores, but this is not always the case. So kind of a loose correlation. Next slide, please. So for generalism, we found that generalism was demonstrated well across all cases. After some discussion, we felt that even though the cases scored highly, we felt that a lot of the topics were not explicit, but rather were actually inferred based on other information in the case. So we suggest for the case editors that they could explicitly demonstrate some of these topics to boost their scores and to deliver a better learning experience for the students overall. Next slide, please. Then for EDI, since, as we said, the EDI score was quite low across all cases, there's a few key reasons for this. So first of all, one reason for this is that the scoring system that we developed emphasizes racial and cultural health disparities as a learning point. So if a case did not demonstrate or discuss these health disparities, it could lose up to 8 out of 25 total points. And this is further backed up by the average scores for these questions of 1.6 and 1.3 out of 5, showing that these health disparities were not discussed very much. So our suggestion for the case editors is that discussing or demonstrating these racial and ethnic health disparities could significantly boost scores across all cases. Next slide, please. Continuing with this, the scoring system that we used also emphasizes social and structural determinants of health. So as we mentioned before, this is essentially the idea that non-medical factors like income, education, and housing can affect health outcomes for patients. And again, if a case didn't examine these determinants of health in the context of patient behaviors or in the context of a treatment plan, the case could easily lose 8 out of 25 points. And again, the social and structural determinants of health questions scored on average 2.4 and 1.9 points, showing again that this isn't demonstrated very well. So our suggestion to the case editors is just include even just one example of a social or structural determinant of health and how this affects a patient and treatment plan to boost scores overall, and to include important discussions about these determinants of health. Next slide, please. And finally, the last point that I mentioned was only 8 out of the 24 cases were rated as yes for representing a diverse range of identities. And the tool that we used or developed included a number of categories. So you can see on the chart on the right, it just breaks down the identities by the number of cases that scored yes as representing this. So our suggestion to the editors is that the cases that scored no for this question could include even one identity from this list. And we would particularly like to emphasize the categories that have not been represented in any cases. This is particularly important as in medicine, we have a very diverse range of patients, and learning about these different groups is key to being an effective practitioner. Next slide, please. I think this is back to Kuda now to summarize.
Okay, so to summarize mainly on the EDI discussion, we found that all the cases in first year are critically lacking in these 3 main components of EDI, which are critical to medicine. So the first one being they are lacking in racial and cultural health, discussion of racial and cultural health disparities. There's a lack of discussion of social and structural determinants of health. And there's also low representation of diverse ranges of identities. So we would recommend that case edits should be made to demonstrate these 3 components. Can I get the next slide, please? So some recommendations that we came up with based on our work and for people who may want to take on similar project ideas. Firstly, I think it's very important to clearly define all the terms to prevent any ambiguity with scoring. And this will also minimize highly discrepant scores. This was something that we found when we were reviewing the cases together after rating them independently. Secondly, it's important to have discussions to address any discrepant scores. So I think a key point is that sometimes the information is missed by one rater, and this may lead to a discrepant score, but when you have that discussion, there's an opportunity to change the score and streamline it between raters. And it's also important to recognize that a student reading the case may also miss these key points. Lastly, it's important to also take note to justify any low scores, as this will help with highlighting ways that we can improve the case to improve the learning opportunities for all students. Thank you. The last slide is just the bibliography with all of the resources that we use throughout our project.
All right. Thank you so much, Kuda and Tom, for outlining that. I just wanted to jump in before turning it back to Everett is a couple of questions in the chat. Whereas on the one slide talking about unique circumstances in terms of the grading for the patient case description, what does that mean? I just want to highlight that comes from the way the authors of the Christian et al. Paper that we use as a foundation of this work, when they highlighted this guide for teaching cases, you know, a lot of it was around the idea that when you present a case, particularly in medicine, a lot of these mock cases or simulated patient cases, is to ascribe a characteristic and a unique circumstance for that patient, rather than to allow for unintentional or even intentional sort of stereotypes or biases to come in. So I think the monkeypox example might be one that's common in, you know, the news right now. Although the current epidemiology shows that there's a higher rate in gay men at the present time, that may not have anything to do with the actual monkeypox virus or transmission, right? Is that we don't yet have further data for this. So if we were to describe a case about it, that case would be about the presentation of the monkeypox illness. So presents with fever, presents with rash, generally unwell, but that we shouldn't automatically, you know, attribute other components to it, such as race or such as gender identity or sexual orientation, just because that might be what we're seeing in the literature. Same thing might be, you know, around for a lot of the work we're doing, things like a melanoma case. You know, we typically talk about melanoma in fair-skinned individuals, but there's increasing evidence and lots of research talking about individuals with darker skin and in the Black health population, that melanoma is poorly recognized, but occurs just as frequently, and it can lead to very poor health outcomes. So it's just the idea that unique circumstances, describing the patient in their context, and then attributing factors that may be relevant, but to that person, rather than generalizing to a group of people and maybe unintentionally bringing in stereotype or bias. So this is definitely work that we're excited about. This gives us a ground of this is where we're at today in August of 2022. And we're very keen to take this on immediately and look at how do we change and update our curricular materials in order to bring this conversation into the education sphere for our future physicians. So thank you for your attention, everybody. We're very much open to your comments and your questions. Everett, back to you.
Yeah, thank you so much, Jaime, Kuda, and Tom. You can actually clap for them or do something in the chat for them. So this brings us to the sort of the conclusive part of our presentation. Just before we get into the Q&A, I thought of sort of having reflection questions for all of us after attending the session. How does social location and EDI influence my pedagogy? And then something else just from the discussion, from all our discussions, my discussions, Jaime, Kuda, and Tom, and Lisa. Something else we might want to think about is what is cultural competency and how is it dialectically related to course design, redesign, and my teaching practice? And then a third question we should all go home and ponder about is how can I be a more critically conscious education leader?